What's up, guys? It's about 5 a.m. in the morning. About to go check out to the hospital. About to go see some patients up on the floor, which means patients we did surgery on yesterday. Just putting on my white coat. So these are patients that I operated on yesterday. So basically, go check on them, see how they're doing, give them some pain meds that they're doing. They're having some pain, and hopefully get them out of the hospital after a knee or hip replacement. Patients usually stay in the hospital about a day or 2 days. So when I come in for the morning, I basically round on patients and see how they're doing, see how they did overnight, check their labs, make sure they don't have any abnormalities in their labs, and then go see the patient and see how they're doing. Most patients go home either the first day after surgery or the second day, but for the most part, patients with a hip replacement or a knee replacement do fairly well. They don't have much pain after surgery, so hopefully I can get some of these patients out today and discharge them home, and then we will see them back in clinic in usually 1 to 2 weeks. Just got out of the operating room. We did 2 knee replacements today. The surgeries went well. It's about 2 p.m. Your schedule in residency kind of fluctuates from being extremely busy to being not as busy. There's not many times where it is not busy. I plan to use the rest of the day to study and also do research. So I'm here in the resident library, orthopedic library. Someone left a lot of scrubs. We have a lot of books and articles that we use to study in this room here. So I will spend a couple hours doing some studying for surgeries, preparing for surgeries for tomorrow, and also studying for my boards. Check out my other video about preparing for my orthopedic surgery boards. To become board certified as an orthopedic surgeon, you have to take an exam. It's 8 hours. It is after your 5th year of surgery training, and I have it coming up in 12 months and 1 week. So a year and 1 week. So the chief's residents who graduated this past year, they take their orthopedic surgery boards to become board certified next week. So I have about a year or so to prepare. So definitely studying hard each day, doing a lot of questions, but check out that other video and you'll study with me a little bit here for the next, 3 or 4 hours. So also in the resident library, we have a lot of tools that we practice with, different instruments, a lot of sutures here. We can practice suturing, things to practice act like a makeshift surgery. There's a drill here. I'm not even sure if this drill works. Let's see. Actually it does, yeah. That's pretty cool. Has a light on it. It's pretty high tech. Some screws, whatever this sign says. Never seen that sign. A lot of different instruments, and this little thing right here, this is a something that we use to practice different procedures, like a arthroscope. It's like a knee scope, fix someone's ACL or meniscal tear or some type of intra-articular pathology. We use this little machine right here, and this is fairly new that we recently got. All right, basically this is how we practice for orthopedic surgery. One of the ways, work on your hand-eye coordination as well as it's called triangulation. This is a makeshift model that we can practice like doing knee scopes or ACL tears, meniscal tears. So there's a time that you're supposed to do this in. This is my first time doing it. I don't know if I will be able to do it in a minute and a half, but let's see. It's like playing a video game, and sometimes in surgery, this is a very similar kind of feeling. All right, let's put a couple on back. that gives you an idea of what's it like to operate under using an arthroscope, which is a basically this little instrument here has a light source and also a camera, so we can see different things like the ceiling there. So. Now I am about to head to a meeting, and then after that we have what's called fracture rounds. Basically when we meet and talk about different kind of surgical treatment options for different types of fracture. So fractures that like a tibia fracture or a femur fracture, hand fracture, and we talk about it as a group. How would you fix it? What would you fix it with? Some complications that can go wrong in surgery, and that's called fracture rounds. And we have that usually like one time a month or so. And then after that, I may hit the gym up and then prepare for surgeries tomorrow. So here we go.
Fractures. Yeah, wow. So you can also put little condyle bolts too on each side of the screws. If you have like a new piece to kind of compress it. It's just the target stuff. On that table beside the gamble, we have our retrograde subcondylar nail, which you can get 4 screws at the 32 millimeter spacing.
Just a little less air. Ventilate. Please pay close attention to the instructions in this video, because they will help you learn skills required.
So today was a pretty slow day. Wasn't too bad. I did 2 surgeries this morning, and then I have meetings for the rest of the day, as well as probably gonna work out. But I'm out here in this heat, walking to the ortho office to go study a little bit. It is extremely hot. I am about to die of heat. I need some water. It's a long walk. It's about 110 degrees out here, feels like. But